work in practice. Sarah Robinson is a clinical director of surgery and a consultant surgeon herself at Northumbria Healthcare NHS Foundation Trust. The trust introduced 7-day services 10 years ago. So what did that involve?
Hello there. Essentially, it's involved a multidisciplinary approach, really. It's not purely the consultants. Your other guest is correct in that you do need your other services to be available, such as physios, OTs, hospital to home. But I do think it's essential that consultants are present and are available. We're dealing with an increasingly complicated patient cohort, increasingly elderly with multiple comorbidities. And particularly for a surgeon, it's highly valuable to have the help of consultant cardiologists, respiratory physicians, intensivists available before we do, for example, emergency laparotomy, to optimise that patient and give them the best chance of success.
But was it possible to do that without increasing the number of consultants? Because that was the point that Chris Smith was making, that, you know, in an ideal world, yes, but you'd need more budgets to be able to do it.
Well, we opened our emergency hospital 5 weeks ago, and we've managed to do it without expanding our surgical consultant workforce. And we have expanded some of the other services, such as the input we have at a more junior level, but we haven't needed so far to expand our consultant numbers. We've just altered the rotas and been a little bit more accepting of the fact that our weekday working is a little different.
And what about support staff?
We are absolutely dependent on the ancillary staff, physios, for example, post-operatively for mobilising, chest physio to reduce chest infections, the OTs to get people mobilised quickly and assess what they need to have to allow them to get home and helping themselves.